Hi there, I'm Dr. Stephen Phelan. Welcome to this new video. Today is another video in my provisional series from webinars questions answered. And today I want to talk about provisional veneers because we do get a number of questions. For example, Dr. Blank and a lot of other people, Dr. Jeff Blank and a number of other dentists ask, which cement do you use to cement the provisional veneers? And here's the thing. Provisional veneers are typically not as retentive. So the way that I do the cases, if you've watched me for any length of time, you'll know that I don't prepare my veneers too aggressively. A lot of the time I don't even break contacts. So my provisional veneers are fairly fragile because of this, because they're not super thick and they don't wrap around the tooth as much if they don't break contacts. So with that in mind, I have to use a more retentive provisional material. And the one that I like, especially if you're getting started and you're not as used to this, I would recommend a product called Neotemp from Waterpik. And this is a temporary resin cement. And the nice thing about Neotemp is you can fill it into the provisional veneer and seat the provisional veneer on the preps. And I fill it enough so the excess extrudes. And with this product, the excess will extrude and you let it get to a rubbery state and it peels off nicely. And it's still quite retentive, good resistance to micro leakage, and retentive enough for a shorter term provisional veneer. So I'm thinking, anything under a month. If I have a case that I know is going to be longer term in provisional veneers, I'll typically use something more retentive, and that is just using flowable composite. So flowable composite's very retentive. You have to be careful with that though, because it's so retentive, it's hard to get them off. And I typically need to section the provisional into a couple of different areas, sectioned, like kind of vertically section it, and break it off. So it's great for long-term provisional veneers, but it's harder to get off. So I don't recommend it until you really get used to this. And typically when you're starting out, you'll have quicker turnover if you're doing a smaller veneer case. So I would try out Neotemp. I think it'll be good for you. But once you get used to it, or if you're doing a rehab case with some veneers where you know it's going to be longer, using flowable composite is really good. Just be aware that it's harder to get it off. You have to kind of section the provisional into a couple of different sections, and then you can typically get it off with a scaler or a crown spreading instrument. So sometimes I'll just section the provisional and then just break it with a crown spreading instrument like the Brasseler one, and that works out pretty good. I can show you a picture of that. Here's the crown spreader. And that is a good instrument to use to break and kind of disassociate the provisional veneers from the prep. You need a lot of magnification and light to do that because you don't want to actually re-prepare the prep. One thing I'll tell you is if you break the contacts and you have more of it's almost like a 3/4 crown instead of a veneer where you don't break the contacts and it's very light, thin veneer provisional. If you have a bit of a thicker veneer provisional and you've broken the contacts, Duralon can work pretty well in those cases if you've broken the contacts and they have some level of retentive design because it wraps around the tooth. Duralon works reasonably well for those provisional veneers, or Neotemp. So again, the more conservative you get with veneer preparations, the thinner the provisional gets, the harder it is to manage the provisional. It's just fact of life, unfortunately. So hopefully that helps. A couple of other things we do with provisional veneers that help is I typically spot etch. So I wouldn't do that with Duralon, it wouldn't help. But Neotemp I use to spot etch. So I do a small 1 millimeter, maybe 1.5 millimeter spot in the center incisal third of the tooth. And that helps with retention. And the other thing that I do is I use Gluma desensitizer or G5 desensitizer, some form of desensitizing agent around the preps because I'm not putting any adhesive, any bonding resin at all. It's just flowable composite or neotemp. So because of that, the desensitizing agent helps decrease the micro leakage and sensitivity. We just don't get sensitivity around provisional veneers, and I think maybe the desensitizer helps with that. That's a big tip though. Do not, if you spot etch, do not use any adhesive, no primer, no kind of adhesive resin. The Gluma product should only be the desensitizer, not the Gluma bond. Just desensitizing and whatever cement you want to use, be it Neotemp, Duralon, or flowable composite. And that's basically what I do, and we've had great success over 20-something years making provisionals with those materials. And you know, some people will knock off their provisional veneers, but it's pretty rare. I've got the, you know, we have the odd patient that they knock them off. Most patients don't. Most patients don't. So that's about it. Hopefully that helps answer that question. And if you're interested in seeing these cases, you can attend the video case studies webinar, and the easiest URL for that is vdoseminar.com. So vdoseminar.com. I'll post a link below this video to register for that seminar or webinar, whatever you want to call it. So thank you very much, and we'll talk to you soon. Take care.